Well, good afternoon, everyone. And thank you, Janet, for the introduction. I'm Ritika Gupta. I'm a reporter at Bloomberg TV, and I'm delighted to be here. I've been looking forward to this panel, Automation That Packs a Punch, that focuses on how organizations are using automation, but also how they're taking it to the next level, how to create high-value projects that work, and how to avoid those that don't. And to get into all of this, I have some fantastic panelists here with me who I would like to reintroduce. Yin Aphinyanaphongs, he's the Director of Operational Data Science and Machine Learning at NYU Langone Health. Suvankar Mazumder, Chief Technology Officer, S&P Global Ratings, and Neil Green, the Executive Vice President and Chief Digital Officer at Otis. Thank you all for being here with us today. Now, first of all, just to get started, if you could each just go through and explain about your company and your title and what you do there. So we'll start off with you, Yin.
Sure. Hi, everyone. My name is Yin. I'm an MD PhD, and I'm an assistant professor in population health. So I write papers about AI and large language models at our institution. But I'm also in charge, the Director of Operational Data Science. And what that means is my role is to facilitate the translation of AI models into actual use cases for NYU. So we have about 20 use cases that are in production today that are helping various aspects of our organization. And I like to think of our organization as, I was talking to one of my colleagues at Apple. It's, we know there's an iPhone, and we know there's hundreds of applications that are AI applications that are supporting that iPhone to do certain things. And so for NYU, we're like a huge iPhone. And my job is to find all the use cases that we can use across the institution to support our operations and our clinical missions.
I like that analogy. Neil, on to you.
Great. Good afternoon, everyone. I'm Neil Green. I'm with Otis Elevator. I'm the Chief Digital Officer. That means my role is to really transform a 170-year-old company into how do we think digital first, how do we think connected systems. Otis has over 2.2 million elevators that we service on an annual basis. And my biggest objective is to help reduce the downtime for our customers. So how do we use artificial intelligence for predictive analytics? How do we drive better efficiencies? How do we deploy IoT? How do we automate the workforce so we can drive better service for our customers? So happy to be with you this afternoon.
And Suvankar.
Hi, everyone. Suvankar Mazumder. I'm the CTO of S&P Global Ratings. Ratings, I'm sure all of you have heard of. If you haven't heard of it, you've been impacted by some form or the other, whether it's your own personal fund or if you're in finance. And I like to think of ourselves as, although it's not officially, I like to think of ourselves as a tech-enabled data company. Data is obviously the fundamental ingredient that drives everything, but really it's the technology that's going to make it far more useful and reachable to our users. So with areas that we are looking into, and I'm not going to, obviously we can talk about the large language models and other areas. We also have our own data science wing division, which is purely looks at all different kinds of ways of we can actually automate and different levels of automation. So that's really what we do.
Great, perfect. So one of the key arguments for automation is that it can increase efficiencies, reduce costs, or improve the quality of a product or a service, and therefore helping to maximize stakeholder value here. So if you could give some examples of how automation or AI is having a real big impact in your company. I mean, Yin, I'd like to start with you. I mean, how are you using predictive analytics to improve the outcome with patients?
Sure. So measurement's incredibly hard in medicine. As you know, when we have drug products and other things, there's an enormous amount of effort spent in proving that things like Paxlovid and other things actually work. And so we do that on a much smaller scale. Out of the 20 models I told you about, every one of them has measurements assigned to it in terms of monitoring that we know what it's doing downstream. One of the most important use cases is less about doing the predictions as much as reducing variability in the people that are making assessments on our patients. So for example, we have a COVID-19 adverse event model, and what it does is it predicts whether a patient will have an adverse event, such as a deterioration that requiring them to go to the ICU or otherwise. This came to us from some nursing staff because they were looking at patients and they had no idea how to communicate with the next person coming on staff how sick this patient was. And so they came to us and said, hey, look, can you help us with this communication process? Can you help us identify how we can sort of take this patient and say they're high, medium, and low. And so we built them a model to do this, right? And the success of the project wasn't around saying, oh, this person's super sick and this person's not. It's trying to create a unified language that reduces variability in people communicating with each other about how sick this patient was. That's one. The second one was in-basket messaging. So if you are an NYU Langone customer and you're using your in-basket messages, we have proof of concepts and pilots in place where a machine actually reads that message to try to determine whether this is something a human needs to respond to and give you a call back. This is especially useful over the long weekends, right, when we potentially get thousands of messages. And Monday morning, right, one of our nurses or NPs or providers sits down at their computer and they see hundreds of messages. So how do we sort through this in a way that we can prioritize the ones that really need attention right now? And then over the course of the day, we work through the rest of the messages. And for us, this is a way of providing great value to our patients, right? Of providing them, timely information of what they need, when they need it. We're in the process of creating measurement tools around this. It's actually really hard to measure the impact, but we're doing that today and hopefully getting papers out of it to write about that experience.
And Yin, just to follow up there, because I'm interested to know how the pandemic really changed the outlook to automation, whether that actually spurred up that drive, because during that time, I imagine you had an overload of patients and a shortage of staff. So is that something that really catapulted automation in,
So, and I'll just say in a nutshell, I think that really spurred on our thinking about practicing what we call agile data science, right? And so this is kind of like the hello world of what we do. So I got a call on Sunday from my operations folks that said, look, guys, this thing is going like crazy and we need help. We need to figure out some models that can help us sort of triage, identify sick patients. At the time, there weren't enough tests. Right, so one of the first models we built was, can we predict whether the test is going to be positive if you don't give a test? And so, by 3 or 4 days later, we had 2 models in production, or we had 2 models running. By a week, we had about 7 models. And then from that, we went to our team and said, look, we have this menu of options. Leadership, you tell us which one of these you think is important for us to move forward on. They eventually landed on this COVID-19 favorable outcome model, where we were trying to predict whether this patient would deteriorate in the next 4 days. And the reason they did that was because as it was escalating higher, we had hospitalists, we were including physicians who aren't hospitalists on a daily basis. And so we wanted to provide them with some decision support to say, hey, look, this patient actually is okay. And you might think that, and you might not be sure, but our system is augmenting your decision making, saying, yeah, okay, this person can go to a lower level of care, open up a bed, and getting an option for someone else who really needs it to be in that bed.
And Suvankar, turning to you now, I imagine at S&P Global, for your clients, that's the issues really going through. They've got an abundance of data and having to sift through that. So how are you using, AI to sort of create useful data sets?
Sure. The first thing I would say, I didn't realize this before I joined Ratings. We had the highest number of credit analysts in the world in any one place. And essentially what we look at is really analyzing risks. And there are, apart from the normal financial areas, where the other area that we do a lot of work is essentially in the public finance area, which is essentially any large-scale infrastructure, any large-scale projects that you can think of, to the level of a town's school is actually rated, and Ratings has a part to play. So the data sets and the things that we talk about is really important in terms of some of the decisions investors make, obviously the issuers. And the way I like to think of this is, and I like to look at this is, there are 3 levels, I would say, very high levels of automation. And one is, there is a lot of repetitive tasks that we need to do when we collect all this data. So we look at how we can collect all this data much more efficiently, extract that data much more efficiently. And obviously the first level, what I call it, is a very basic level where you're actually doing automation to copy human work. It means things that a human can do as fast, but things such as copying data from one place to another or inputting data. This is where robotics, RPA, most of the time where we use it for. The second level is more what I like to think of it as cognitive insight, which was when I started in financial world many years ago, we used to do things such as market signals using mainly rule-based systems. nowadays, obviously, there are much more larger models that you can use to look at patterns of data. And where our usefulness is, where you can use it, and the way I see this is there's so much more data there, but we don't always know how to connect it. I mean, even if we know how to connect it, we don't know what the outcome of that connection is. And this is where I do think the real benefit of it is. Having said that, and then obviously the large language models and others is more cognitive engagement, where you have to constantly train, talk, essentially prompt in order to get to the state that you want to get. But overall, I think in the data business, and if you're in the data business, a lot of it is what questions can the data answer for you? And that's where it starts from. I can give you several examples from, now obviously larger examples are from ESG factors, which is a part of our offerings now, right? So from whether a particular large public scale initiative and what factors will actually impact it. So there's a lot of predictive analytics is where we think we are using a lot more of it.
And you mentioned efficiency, Suvankar, so I want to pivot over to Neil there on that and ask about, in the, elevators and escalators, how are you kind of using automation and in that kind of process to make things safer and more efficient for your mechanics?
Yeah. There's two examples I can give to illustrate how we think about automation and use of data. The first is about 4 years ago, we deployed smartphones to all our 34,000 mechanics around the globe. And with those smartphones, we created specific applications to help them do their jobs better. One of those applications we created, it's called Tune. Basically, we ask the mechanics to start at the bottom of a building, turn on the application, and it records sound, vibration, and acceleration. And based on those three data points, we send that recording through an AI algorithm, and the algorithm comes back and says, we recommend to the mechanic that you look at A, B, and C. It may be check the roller guides, it may be check the door operator. There are specific things that the application tells the mechanic to do to help make his job a bit easier. Some mechanics that have been doing the job for 30 years, they can actually listen and be able to predict and think about what they've got to go fix. Others that have been doing it for 2 to 3 to 5 years, not so keen just yet. So this app allows the mechanics to address issues with a lot more precision and in more efficiency than they had before. And then the second example I'll give is predictive analytics. The last thing you want is to try to get out of this building and you're pushing the button for the elevator and you're waiting for 2, 3, 4, 5 minutes, or the elevator never comes and you have to take the stairs. So one of our key focuses, how do we reduce downtime? How do we prevent shutdowns for our customers? So a third of our units are connected. We've been collecting data for over 30 years. How do we use that data to predict when an elevator could go wrong? What are some early warning indicators? What are some heads up or headlights that we should be thinking about? And how do we send the mechanic to the job site with the appropriate tools and the appropriate insights so he can fix a potential issue then and there versus having to come back at a subsequent time? So these are two examples of how we're using automation and how we're using data to drive better customer service and reduce downtime.
Yes, and you've all given some very great examples, key examples of how automation and artificial intelligence is going to benefit the society in a big way. And we know that they've grabbed headlines of late and garnered $1 billion of investment. It seems like any company that mentions it, their stock just pops right up when they talk about AI these days. But there are concerns. We saw it this week, just how the speed of disruption. If you think about Chegg, the education technology company, and those shares plunging. If you think about Samsung, which is banning the chatbot. So many AI experts have said, hang on, we need to slow this down and we need to regulate first before we need to pump the brakes, basically. And I'm interested, Yin, for example, from your field, when you think about, you're dealing with patients' health here, like, do you think companies that they're releasing AI tech before it's really ready for the masses?
Well, I can't really speak for other industries. All I can speak for is, in our industry. And I mean, healthcare is by definition a bit slow, and there's always sort of thoughtful adoption of new drugs, new techniques, right, before it's considered mainstream. If you look at the stethoscope, there's a quote that I give my students from 1913, and it's from a news article where they talk about this general way about the stethoscope, and talking about how it's going to take away physicians' ability to do diagnosis, right, because it's this other thing. Right. Same thing when you look at laparoscopic surgery, right? So using sort of tools to sort of do the surgery, and all these things took a long time to adopt, right? For the healthcare system to say, this is worth it. There's evidence behind it, and so I outlined to you some of the things that we're doing, but we're doing it in a sense of like, we're going to pilot it here, and then let's generate evidence, right, to show that it works in other places, that it's actually helpful, that it reduces, it improves our patient outcomes and reduces morbidities. And this is the same conversation that we have for every technology that comes not just through my shop, but it gets adopted by the healthcare system, because all of y'all are our customers, right? And it's incredibly important that we provide you the best services possible that are evidence-based.
Yeah. And Neil, I'm going to get you to jump in here. I mean, do you agree with that? What do you think needs to be done in terms of regulation to make sure that safety is at the forefront, but at the same time still incorporating the newer technologies that are coming up there? I mean, the technology is already here, and it's regulation that needs to play catch up. Is this something that the companies themselves are going to have to lobby for?
Yeah, from an Otis perspective, I see this technology being really exciting. I'll share some stats with you. In North America alone, we get 60,000 calls to our call center per month. And our goal is to respond to those calls within 30 seconds. Whether it's a trapped passenger, whether it's an elevator that's shut down, anything that happens, our goal is to respond really quickly. And our expectation is there's probably something that we can use chatbots and large language models to help us respond to these customers a lot quicker. Another example are mechanics when they're in a pit in the basement of a building, if they're on top of a car. I don't want their hands on their phones searching for something. So how do I use this technology to do voice search of the large databases of parts that we're looking for? So I see real value to the technologies and the capabilities. We are embracing how do we use it. My concerns from an Otis perspective is how do I keep the Otis data inside Otis and not put it in the public space, number one. And then number two, from a broader standpoint from AI, I think there's inherent bias in how coders write code and the large models or the data sets that they use. And how do we ensure that those whether it's unconscious or not, how do we ensure that that bias doesn't lead us astray?
And I'm going to jump in here because you mentioned exactly where I wanted to go, which was about data security. And, I talked about Samsung being kind of the latest in these big companies that are banning these chat GPTs and kind of chatbot bots here. And I think this is a key issue here. And I want to ask Suvankar over there, with dealing with all this data, and also Yin, we're dealing with patients' data. I mean, how do you go about that and kind of keep that in back of mind when you're kind of generating this technology?
Right. The first thing I would say is it's really important to understand that the way I like to think about the technology is, and obviously there's lots of potential, is really what is it behind the scenes? What is it actually doing now? I don't know what it's going to look at, what it's going to be 10 years from now, but I certainly know what can it do and how can it work. Now the question is, when you talk about data, so once you, at a very high level, without going into too much details, it is essentially current, and if you're talking about large language models, it's essentially what it's doing is it's essentially looking at a probability of occurrence of the next pattern of the sentences that you speak. So it actually has no understanding of what the meaning that you are actually, the sentences that are spelled out to you, even the code that is spelled out to you. I've been using it for a while. So the question I asked, and we should be all very excited about the technology, but let's also understand what is it really can do at the moment. 10 years from now, I don't know. Which is, and a lot of people think, a lot of the time people come down and ask me, well, it can do this for me. I don't have to write code. I don't have to do this. I don't have to write an article anymore. Sure, but it's all about, one of the things, it's actually based on a very simple, I wouldn't say technology, which is neural networks, which is essentially it's learning as you go. It's move forward. There's no way of reversing at the moment. So what you do when you're actually talking to when you're actually typing things in ChatGPT, what you're doing is you're actually making it learn new things and prompting it. So the question I have for what I normally tell people is, in order to ask the right question, the prompt, you have to know the subject anyway. Mm-hmm. So you always have to be able to verify it. You have to be able to know what you're using it for. There's definitely lots of efficiency tools that we can use it, but I don't think as yet that it is that is going to replace certain functions altogether. There's parts of it, yes, and I'm also skeptical at this moment because in terms of you mentioned, Craig, yeah, there's always going to be initial disruption in certain areas, but I think as people understand really, at this point, there is a lot to be learned, because one of the things I would say is it's actually equally hard to ask the right questions and do the prompting than to answer the question in the first place. So if you're going to use it make sure you can verify it. If you are in a good way of a good use case, a very general use cases, sometimes it's very hard to find ask the right question and the problem solution itself.
Jump in here because
Sorry.
I also want to, we've got a lot to cover and we're running out of time. So Yin, also, how concerned are you about cybersecurity here? Because I know that you talked a little bit about how it's banned at NYU Langone.
Yeah. So we've had 40 to 60 years of experience, right, securing our patients' data. Right. It's the #1 pillar before you can do anything else. We are using large language models, and that was a 4-month conversation, right, with our privacy security people about ensuring that what we're doing is HIPAA compliant, is legally compliant, as well as matching our own internal standards for securing the data and not leaking it at all. And this is a core principle that comes down that's throughout the entire organization, right? So when we're collaborating with other people, even other researchers, right? If there's a problem, right, we're going to hear about it. If there's an ethical problem, if there's a privacy problem, right? And so there's a lot of ways that we get this feedback about the things that we're doing, and it's a core pillar. Before we can do anything else, we have to pass through these security bars, right, to make sure that your data is protected. And so, I would just say that it's a long process to get these things approved, but that process is there by design, so that we can be sure that we're making the right steps and taking appropriate risk.
And another key fear that when you switch on the television, they're all talking about, they talk about AI, is job losses and how much human interaction that we are going to need. And I'm keen to get your take, all of you, in your respective industries. I mean, Yin, we'll start off with you. And will deep, learning technologies, are they going to prove better at, medical diagnosis than any doctor today?
So it's 100% no. These tools are about augmentation. It's about helping your physician do things better and do things with less variability than the next person that comes along or who's taking care of you. So there's some things the computer can do very well, and it only knows what it knows, right? But the clinician is there to facilitate all the questions and conversations that you need to have that he doesn't know, right? The computer doesn't know. So when you're talking to your clinician, maybe you have issues that are social issues, about your family, about some other dynamics and things that are going on, and the computer can never give you a good answer about what to do in those situations. And that's what the clinician is there for, is to collate this information. And the AI is just simply giving them one data point, in the same way that you go to get sent for a labs or you get vital signs, right? These are just data points that the clinician can use to collate a full picture of who you are and provide you the best care possible.
And Neil, would you agree with that?
Yes, I don't see AI replacing humans in the foreseeable future. As Suvankar said, if you ask the algorithms to write you a script, if you know nothing about the subject or nothing about programming, how do you know that script is any good? We see AI in large language models useful to aid our mechanics, to help us to be more efficient, to help us focus on the areas that have the highest probability of having issues. So I'm not predicting that our mechanics or even the programmers in my organization will be out of a job because of deep learning and artificial intelligence.
Suvankar, any quick thoughts to add there?
No, I agree with everything, and I think the key thing is really one thing. I know this is about data automation. One thing I do think we need to remember is, apart from all the things that the panel said, which is automation can also take you very quickly in the wrong way, in the wrong direction. So really need to understand what is the data that how you want to protect it, what are you trying to automate, what business process, what data flow you want to actually automate. And obviously there's many other scenarios, but the foundations of that data in terms of how you secure it, where you use it is really important as well.
Mm-hmm. So then on that note, finally, before we wrap up, so how can we create a culture then that embraces this technology, Suvankar?
First of all, don't fear it. Get to learn about it, right? Use it, see what it really does. Also, don't jump into the bandwagon very early. I mean, I think I hear a lot of people, and myself included, when there's a new technology, I just love to go and jump into it and think far more. And we always, as technologists, we always kind of, sometimes we see we overvalue the technology itself initially, until reality six in terms of how it's actually being used. Until it's being used and used in a more responsible manner, I don't think we should definitely embrace it, look at it, how we can use it, but not jump into the bandwagon and follow it blindly.
Yeah.
Yeah, I think we should test, pilot, do proof of concepts. I don't think we should, our first reaction should be, let's ban it. I know certain industries, not mine specifically, they've locked down the capabilities from being used internally. I, on the other hand, want to explore how we can use it to drive efficiencies and better service our customers.
And Yin, what about you with that process of risk and reward?
Yeah, I mean, I think it's all about testing, right? Test, test, test. You have a great idea, you want to implement it, you want to test it and see if it works. Our philosophy at NYU is, the problems that are going to be solved by AI and automation are not my problems, right? They're the problems of the people who are sitting at the front line doing something and having some operation. So for us, it's all about educating. How can we educate our workforce that, look, I have this hammer, and this is what it does. And maybe it can solve something for you that I haven't even thought of. And so for us, that's where the opportunity is how can we engage our workforce in this education process to learn what AI is, how it might be able to be a tool that can help you do your job better, and then how can I facilitate your sort of growth through that use case of being able to make that reality real and being able to make your job more fun and more efficient.
And on that note of opportunity, we do have to wrap up. We are at the end of our time, but that was such a fascinating session. I feel like we could have talked a lot about that, such a big topic. So for that, I do want to thank our panelists here. Thank you very much. Yin Aphinyanaphongs of NYU Langone Health, Suvankar Mazumder of S&P Global Ratings, and Neil Green of Otis. Thank you very much.
You're welcome.